Back to KDK's East Texas Live. When you go to the grocery store right now, you might still be limited on the amount of meat you can buy, but behind the scenes, there are thousands of people working in meat and poultry processing facilities across the country and right here in East Texas. Joining me live now to talk about how they're dealing with the food supply during the coronavirus outbreak is Noelle O'Mara from Tyson Foods. Good morning, Noelle. Thank you so much for joining us.
Good morning. Thank you for having me.
Absolutely. So a lot of questions that people have right now is the food supply stable, especially for the meat and poultry industry?
I first want to start by giving a heartfelt thank you to our Tyson family of team members who have done an incredible job of putting food on tables across the country throughout this global pandemic. Our number one priority has been the health and safety of our team members, their families, and our communities, which is why we've put in a safeguard of approaches and guidelines in order to meet or exceed CDC or OSHA guidance. And to answer your question specifically, I would say there's ample supply, that we have a tremendous amount of focus on ensuring that we are maximizing capacity in order to meet consumer demand, but it all goes back, like I said, to team member safety.
Absolutely. If you can, tell us some of those safeguards that your plants are taking, and what has been the primary focus of Tyson's response?
Our plants and our operations have transformed, and you'll see that coming to life as you enter our facilities, as you spend time in our facilities. And I've experienced this firsthand as I've spent time with our frontline team members. As you go into our facilities, you'll go through a state-of-the-art thermal temperature scan. We also have advanced symptom screening to ensure that if team members are presenting any symptoms, that they go home and rest, or if necessary, see a physician. And then as you spend time in our facilities, you'll see team members wearing masks, face shields. There's barriers as well as markings on the floor for the appropriate social distancing. We have social distancing monitors to ensure that our team members are following the guidelines. And we've also ensured that we're tapping into external expertise. And we're partnering with a company called Matrix Medical, who's a leading health clinic provider for mobile on-site support as well as advanced testing capabilities.
Now, are you testing all employees of every facility in the U.S.?
Right now, we're focused on ensuring that we are testing in areas where there's high risk. And that's determined based on close collaboration with local health officials, as well as we look at a lot of information and data in order to ensure that we have a clear understanding and assessment of the risk levels in local communities. And so we want to ensure that as we go to test, where we see that higher level of risk, that we're providing that as an opportunity to ensure that we provide information and data to our team members, but also partnering with those communities in sharing that information. And we're one of the only companies doing so from a testing and a disclosure perspective. And in doing so, the intention is to ensure that we're sharing information about the best practices that we can be taking within our facilities to also our team members' homes and throughout the communities.
So in plants like, for example, in Sherman, where 20% at least of the employees there have tested positive, then do you take action and test every employee there?
It again goes back to a local by local decision. But yes, if we do see where there's a significant amount of community spread or significant risk within our plants, we do move forward with large scale testing. And we see that as a really critical, important aspect of tools in order to ensure that we're providing our team members information and doing everything possible to keep them safe.
Now, Noelle, let's bring it back to our area, East Texas. We have two plants here, one in Panola County, one in Shelby County, in Carthage and Center. And we've been told by the county officials that there have been cases at these plants, but nobody's really releasing the numbers, the specifics about how many tests have been made. Why is that?
We actually will be disclosing all of our test results in partnership and collaboration with the local health officials. And like I said, we find that as a really important step in order to ensure that we're being transparent, that we're sharing information, and doing everything that we can to partner with our local communities in hopes of slowing down this incredibly difficult, challenging virus.
Yeah, I think a lot of people do appreciate transparency from large plants like yours at Tyson. Some critics, though, have said that Tyson was too slow to react to the virus, which could have led to the outbreaks at many of your plants. Why didn't Tyson act faster to prevent the spread among your workers?
We started our coronavirus task force in January, and since that point in time, we were one of the first companies that required face masks to our team members and wearing them within our facilities, even before the CDC regulations and guidance came out to do so. We were one of the first companies to provide temperature scanning for team members or anyone entering in our facilities. And so we've tried to ensure that we're at the forefront as this ever-evolving situation of taking the learnings and implementing quickly with action in order to keep our team members safe.
Now, KTK News has learned that Tyson has a point system that punishes workers for missing shifts, and critics have called it unjust because some people fear going to work right now. They don't want to make other people sick. They don't want to further spread coronavirus. What is your reaction to those critics?
I want to be clear that if any team members are feeling sick or have symptoms, that they should stay home and rest, and there will be no penalty associated with doing so. As you look across our facilities, we have a majority of our facilities that do not have any active COVID-19 cases. And it goes back to ensuring that we're taking care of our team members, that if team members are not feeling well, that they stay home.
Now, do you have any benefits or paid leave or anything like that for anybody who does contract COVID-19 on the job at Tyson?
Yes, for anyone who does have symptoms or contracts the COVID-19 virus, there are paid medical leave benefits for those team members.
Are you requiring any time quarantined? You know, some of these cases in Sherman were reported just last week. That's just one example. But I know the CDC typically is calling for a 2-week quarantine. Are you allowing that?
Yes, absolutely. We want to ensure that team members, if they do contract the virus, that after they are well, that they stay home through that time period in order to ensure that they're not only meeting our own Tyson policies, but we're also meeting the CDC guidance. So yes.
Last question, Noel. How can consumers ensure that their products from Tyson are safe right now with everything going on?
I want to be clear that there has been no evidence of any risk of the virus transmitting through food, which is critically important for consumers to understand and know. And with that, I also just want to reiterate our #1 priority is ensuring the health and safety of our team members, their families, and our communities.